Emergency physicians are the only doctors who treat every patient who walks through the door, no matter what, any time of day. And I want to work to make sure that basic healthcare access is available to everyone in the country, regardless of their ability to pay.
I want to be part of the solution in the opioid epidemic.
One of them overdosed on heroin, and we brought him back. I asked him how he got on strong, and he said that he turned to IV heroin after he could no longer get his painkillers. He then turned to petty crime to fund his habit. He said during this whole time he tried to ask for help, but there's very limited resources. I think we could do a lot more, and I think that's why I'm involved in advocacy.
I'm involved in health policy issues because I am an emergency medicine physician. So what does that mean? That means I work to revive, I work to restore, and I also work to react to change issues affecting our community. Physicians, providers, and patients must come together in order to do this.
Going to my first night shift, and I had 4 patients die in the span of 4 hours from gunshot wounds. They were completely leakless deaths. 2 of them were veterans, and I thought to myself that doctors shouldn't have to clean up after the failure of the call.
I remember I had a patient intern here that was ready to be discharged from the hospital, and we kept him so we could expedite his insurance so he could get his medications before he left. 3 days later, he was denied his insurance, and we discharged him anyways without any of his medications. At that point, I realized that I wasn't satisfied with the current system, and I wanted to work to change it.
When we first came here, my grandmother was diagnosed with a terminal liver illness and needed a transplant, and she had a delay in her care because of our cultural and language barriers. It was really difficult for us to find access to care as new immigrants, and as a physician, I want to advocate on behalf of individuals who are in similar situations so that no one will delay getting care because of their inability to understand our healthcare system.
So when I was first getting into medicine, I had a patient come in who was having an exacerbation of her heart failure because she couldn't wear her CPAP at night. And the reason she couldn't wear her CPAP was because the shelter that she was staying at wasn't open over the summer. So that was kind of the first moment that I knew that as physicians who get to see these patients firsthand, we're responsible for advocating for them and getting involved in health policy.
Increasingly, we're finding ourselves in a system which doesn't understand what we do or what our patients need. We're speaking up, and we need you to join us so that together we can help shape the future of emergency medicine.